What is hypercapnia and COPD, shortness of breath? Have you ever wondered how the body reacts when it struggles to breathe? Today, we will discuss hypercapnia and its connection to shortness of breath in chronic obstructive pulmonary disease. Hypercapnia is a condition where there is too much carbon dioxide in the bloodstream. This happens when the lungs cannot effectively remove carbon dioxide during exhalation, especially in individuals with chronic obstructive pulmonary disease. In chronic obstructive pulmonary disease, the lungs are damaged. This damage leads to inflammation, narrowing of the airways, and destruction of the small air sacs called alveoli. These changes make it difficult for the lungs to expel carbon dioxide properly. As a result, carbon dioxide builds up in the body, leading to hypercapnia. Shortness of breath, also known as dyspnea, is a common symptom of chronic obstructive pulmonary disease and is closely linked to hypercapnia. When carbon dioxide accumulates, it can make the blood more acidic. This change disrupts normal body functions and creates a feeling of breathlessness. The damaged lung tissue and narrowed airways make it harder to take in oxygen and expel carbon dioxide. This struggle increases the effort needed to breathe and can lead to fatigue in the breathing muscles. Several factors contribute to hypercapnia in chronic obstructive pulmonary disease. One factor is alveolar hypoventilation, where reduced gas exchange means less carbon dioxide is exhaled. Another factor is air trapping, where loss of lung elasticity and narrowed airways prevent full exhalation, causing carbon dioxide retention. Additionally, respiratory muscle fatigue occurs when overworked breathing muscles become weaker, limiting ventilation. Symptoms of hypercapnia in chronic obstructive pulmonary disease can include morning headaches, confusion, drowsiness, fatigue, flushed skin, and worsening shortness of breath. In severe cases, it can even lead to coma. Shortness of breath in chronic obstructive pulmonary disease results from various factors like airway obstruction, reduced lung elasticity, impaired gas exchange, and carbon dioxide retention. Hypercapnia worsens breathlessness by causing acidosis and affecting the respiratory control system. Patients may find it harder to breathe during flare-ups or as the disease progresses. Managing hypercapnia and shortness of breath in chronic obstructive pulmonary disease involves treatments that improve ventilation and gas exchange. These treatments may include bronchodilators to open the airways, supplemental oxygen to increase oxygen levels, and sometimes non-invasive ventilation methods to help remove carbon dioxide. It is also important to avoid sedatives that can depress breathing, as they may worsen carbon dioxide retention. Monitoring and treating hypercapnia is essential because chronic high levels of carbon dioxide can lead to complications like pulmonary hypertension and an increased risk of mortality in chronic obstructive pulmonary disease. Hypercapnia is a serious condition that can significantly impact breathing comfort and overall health. Understanding its role in shortness of breath can help patients manage their symptoms more effectively.